we did just have a patient recently, Valerie, who ended up with an acute clotting situation, and she rushed to the hospital. And of course, they started her on the heparin drip. And then I don't know the timeline. I guess it was within hours that she was on the table. I don't know exactly what they did, but the result was she ended up with a fasciotomy. And she was asking, why did I need this fasciotomy, and how could that have been mitigated and prevented?
Yeah. So what a fasciotomy is when you have restoration of blood flow, and if the muscle cells have been under stress for a long time, so that means they've been without blood flow for a long time. Again, really typically above 6 to 12 hours. And then all of a sudden you restore all that blood flow, the cells, they start to swell up. It's called reperfusion injury. And when those muscles swell, it becomes real big, beefy, and red, and you get what's called compartment syndrome. So literally the muscles swell up so much inside of these little compartments, like bags inside the leg. And if you don't release those compartments, you'll lose the leg. The muscle will die, and then you'll have to amputate the limb. So they have to do a fasciotomy, which is literally incisions made to release the muscles so that they can swell. And then over time, that swelling will come down, and then you can close those incisions back up again. But literally, you fillet the leg open in order to save the leg. This condition is largely preventable. If you show up to the hospital right away, they should be able to do thrombectomy, or essentially get rid of the blood clots right away and really reduce the risk of reperfusion syndrome. The problem is people who end up getting delayed reperfusion, delayed reopening of those blood vessels, they're the ones that are more likely to end up with compartment syndrome and need for fasciotomy than the people that get treated right away.
But how does the doctor know going in? We've had a situation where someone had the clot. It was probably, a combination though of chronic and acute clot, but ended up with that. And the way the doctor described it was she poked the beehive, and she wished she would have gone in with a little bit of a drip overnight, to kind of soften things up.
Yeah, I disagree with that. And that's been like the mantra for a lot of people. The problem is, it's the tools that you use. And I'll talk about that tomorrow as well for docs that are interested in dealing with these kind of patients. You want to do some type of procedure, whether it be aspiration or extraction, tools to really restore blood flow down that leg. And then if you have some leftover blood clots, small little areas of clot, that's when you can use the drips and whatnot too. When she talks about poking the hornet's nest or the beehive, what happens, you cross with a wire, and then they try to go in and do something, maybe they balloon, and then they send all of that clot downstream. And it's called trash foot. It's the worst thing. And then now all of a sudden your procedure takes so much longer. You lose a bunch of blood vessels. You risk causing gangrene. And that's why they said, well, I wish I'd softened things up with a blood thinner first. The reality is, you want to, if you know that it's all soft and squishy and liquidy in there, you want to suck all that stuff out first and then reassess. And then if you need a little bit of adjunct to blood thinners, you could certainly do that at that point. But again, if you don't establish flow, that muscle is still dying. It's still in distress. And those people are going to be more likely to get reperfusion syndrome.
And so what are some of the questions that they can ask if they end up in the emergency room? How can they advocate for themselves to ensure that the doctors act soonest?
Yeah, I mean, it's really about communicating what they're feeling. You can say, if you're having numbness, you can't move your foot. These are what we're called advanced signs of limb ischemia. So lack of blood flow. So that is a very late finding. If your foot's going numb, if the leg is going cold, if you're not able to move the leg. So muscle issues and nerve issues are very late findings. That's very dangerous. Needs to be treated right away. Now, there's some people that present with a kind of a chronic, acute on chronic type thing, but they have what are called collaterals. So blood vessels that they have formed over time, they're still keeping blood flow going down to the lower limb. Those people are better off, and they tend to have less of a consequence after having a procedure done. But it's the people that really have no collaterals, they have no flow. They're the ones more likely to have nerve damage and muscle damage.